Hey guys, Brock from Command here. Thanks for joining me on this stormy Friday. I've lost about 5 pounds today from a much needed haircut, so I'm pumped and ready for this video. We're going to be covering vitamin B12 and folate, as well as MTHFR gene mutation and homocysteine. Some common causes of vitamin B12 deficiency or folate deficiency even is going to be a poor dietary intake of these things, especially with strict vegetarians. Typically would benefit from supplementing with a really good vitamin B12 and folate supplement. But we also see low vitamin B12 levels in folks that consume a significant amount of alcohol or that have liver disease. Also in folks that take metformin or acid-reducing medications like Prilosec or Pepcid for GERD or reflux and gastritis. And there are a number of other things that can lead to low vitamin B12, such as excessive zinc intake, which will lower your copper levels, really a number of things. Low vitamin T is relatively common. It's not super common, but what is pretty common is suboptimal levels of vitamin B12. And that's because the lab ranges for B12, what's considered low is pretty stinking low. You know, levels that are more likely to lead to like an overt anemia or something like that. But folks often have a level just above the lab range. Maybe it's in the high 200s or the 300s. And that still makes you susceptible to potentially having low bioavailable levels of B12. And we'll cover that a little bit more later. Symptoms of B12, if it's low enough, it can cause something called macrocytic anemia. And symptoms of anemia be things like lightheadedness, significant fatigue, headaches. And then B12 deficiency can also cause things like depression and irritability, low energy levels, actual weakness. And it can also cause numbness and tingling in the extremities, more commonly in the legs, and even things like balance issues, neurologic issues. But vitamin B12 deficiency is it's not super common, but we do see it. What we see more commonly, again, is that suboptimal B12 level that could lead to kind of more mild B12 deficiency issues. Maybe your energy is not very good, or you know, you just feel a little bit down or a little bit more irritable than you should, and it doesn't really add up. It's not, it just doesn't really quite make sense. Vitamin B12 is really important, again, for energy, for your nervous system to function normally, for good mental health. And then for folate, we actually see, you know, folks are often familiar with folate being an issue with pregnancy. If you're not getting enough folate in while pregnant, it can lead to things such as neural tube defects. So for neural tube defects, think of the brain and the spinal cord, which is the central nervous system. The pregnancy, the unborn kiddo can have anencephaly, which is a lack of proper brain growth and development, as well as spina bifida, which is where there's a gap in the actual spinal column where the spinal cord will kind of jut out through the spinal column into the back underneath the skin. And while often treatable, that can lead to neurologic deficits in a kiddo. So let's touch base a little bit on MTHFR gene mutation. It's going to kind of pull together some of the vitamin B12 thoughts. MTHFR gene mutation, it stands for methyl tetrahydrofolic reductase gene, I believe. At least that's in the ballpark, what it stands for. And it's a very common mutation. Approximately 40 to 60% of folks in the US have some form of MTHFR gene mutation. Now, there are two genes underneath that umbrella of MTHFR gene mutation. There's the C677T mutation, which is the worst of the two, and there's A1298 or A1298, and you can either have one or both copies of one of these genes that are mutated, or any combination thereof. So the very worst MTHFR gene mutation you can have is both copies, also known as homozygous, for the C677T gene. And this leads to about a 70% decrease in your body's ability to methylate. So in order for B12 and for folic acid or folate to be available to the body to be used, or bioavailable, it has to have a methyl group added on in order for it to be consumed or for it to be utilized by the body. So that's why this gene mutation is important, because if you have one of these mutations, you're going to have a decrease in methylation, and so even if your labs look decent, the actual functional level of B12 and folic acid is probably going to be lower than what it looks like on your lab values. And especially with this C677T homozygous mutation, that one tends to increase a very pro-inflammatory molecule called homocysteine. And elevations in homocysteine can lead to heart disease, it can lead to blood clots, and it can lead to pregnancy complications and a few other things. Again, it's a very pro-inflammatory molecule, and we know that inflammation is kind of the root of all evils in medicine. So what we do from a clinical standpoint is we can either get a MTHFR gene mutation test for about $76 at LabCorp right now, or we can draw a homocysteine level for $13, and as kind of a screening measure to see if it's likely that you have MTHFR C677T homozygous mutation. Or if you have that and you're not supplementing or eating enough in your diet, to kind of make up for that mutation. And so those are things that each provider is going to be different in terms of how they screen folks and whether they measure for these things or not. I like to get these homocysteine levels in my patients as just kind of a screening measure. Just because of how common these mutations are, especially the C677T mutation, the 2-copy homozygous, the bad one. I think upwards of 20% of the population can have this mutation. So I like to screen my patients for this. And as far as treating elevated homocysteine specifically, we typically do kind of a higher dose methylated B12 and methylated folic acid supplement like methyl B complex from orthomolecular products, and then we'll kind of measure that homocysteine and B12 and folic acid levels months later to see if that homocysteine levels come down. And then for folks who are generally, maybe not worried that they have the bad mutation, or maybe they test negative for elevated homocysteine, because of the prevalence of MTHFR, I still generally recommend a supplement that has plenty of methylated B12 and folic acid in it. My go-to for that is Mitocore by Orthomolecular Products. Has really decent amounts of methylated B12 and folic acid, as well as some excellent polyphenols and natural antioxidants and anti-inflammatories, things like inositol, which is great for metabolic health, ovulatory health, hormone health, and then things like N-acetylcysteine and even resveratrol, which is kind of being studied right now for possible longevity benefits. And so I recommend most of my adult patients take Mitocore as kind of a baseline of getting plenty of methylated B12 and folic acid in, as well as some of the other benefits from the polyphenols and antioxidants and anti-inflammatories. For folks that have a really overt B12 deficiency, sometimes we'll do that methyl B complex, which has about twice as much methylated B12 and folic acid as Mitocore does. And then for other folks, we need to go ahead and do something like a vitamin B12 shot to really get a huge bolus of B12 in the bloodstream. And for that, we're usually doing, let's say, a B12 shot once a week for a month, and then maybe go to monthly shots and kind of watch your B12 levels over time and make sure that they're correcting and looking much better. A lot of folks notice that their energy kind of improves. They just feel better after they've resolved a vitamin B12 deficiency. So guys, that's a very general overview of B12 and folic acid, and then the MTHFR gene mutation and homocysteine. And my overall recommendation here is that you feel free to talk to your command provider to see if you might benefit from being screened for an elevated homocysteine level, which is $13, or even the MTHFR gene test, that's $76. It's just nice that at command we have the flexibility to get these wholesale labs and really pay attention to the finer details of your health instead of sticking to the super broad annual labs. We have a lot more flexibility. So with that, I do want to touch base a little bit on our featured command service, PRP and prolotherapy today. So I've done past videos that cover this, but I just want to mention, if you have any orthopedic concerns, starting, let's say, with the heels, plantar fasciitis, or maybe a chronic ankle instability, or an Achilles tendonitis, or moving up to the knees, if you have a meniscus issue, if you have a ligament issue, if you have osteoarthritis of the knees, or even elbows with tennis elbow or golfer's elbow, or a wrist issue, or shoulders, which is a really big one for us, rotator cuff issue, labrum tear, something like that. Prolotherapy and PRP are a really good go-to for anything from those ligament and tendon issues to plain old osteoarthritis. So prolotherapy is $50 for our command patients, and PRP is $300 for our command patients and $600 for non-command patients. But prolotherapy in a nutshell is dextrose, which is sugar water, combined with some lidocaine and sometimes some sterile water, and we inject that into the problem area. Directly into a tendon. If it's a tendon issue, if it's more of a general joint issue or like a meniscus issue, let's say, we'll just go into the knee joint space. But what that dextrose does is it wakes the body back up. It kind of restarts the healing process so that your body can increase blood flow to those damaged tissues and send platelets down there with the repair mechanisms to tack things back together, to mend scarring, and just get you in a better spot. But that is the lesser potent of the two. PRP, which is a lot more powerful, is where we actually draw your blood and spin it down, and we take the platelets out of your blood. It's platelet-rich plasma. So we take the platelets out of your plasma, and we inject that directly into the problem area as well. And what that does is it not only wakes back up the healing response, but it actually delivers the platelets that house the growth factors that your body needs to tack things back together. So not only wakes up the healing response, but it gives your body what it needs right at the site of damage. And so this is a great thing to consider. I recommend that you talk to your command provider about this if you have any orthopedic issues. Usually prolotherapy or PRP plus some physical therapy can really go a long way to sometimes completely resolve your symptoms, or typically at least deliver a significant improvement in how your joint is feeling. So guys, with that, this wraps up April 2025's video newsletter. Please reach out to your command provider to discuss any of these things that I've talked about. If you have any questions, or if you would like any testing or kind of investigation into these things for you. Thank you.